Welcome back. My name is Dr. Guaramuz, and we are continuing our lecture on public health through the integrative medicine scope. And we were talking about how public health is a complex adaptive system. And in particular, we were appreciating that a conversation on policy must acknowledge that public health is a complex adaptive system so that we provide a nuance-based conversation um, to policy making and reform so that we are taking into account the several variables and multifactorial aspects that determine the quality of public health or the quality of the healthcare system, which provides the public with health. Now that we can appreciate that at the local level, at the level of the individual, health is a phenomena of a complex adaptive system, meaning that health is dependent on multiple variables and agents interacting so that health can emerge. We can then obviously deduce that public health is similarly a phenomena of a complex adaptive system, meaning that the health of the public as a whole or the health of the healthcare system is dependent on multiple factors. It's dependent on available. Well, so let me explain a little bit about the model that we have before us. This was a study done by some public health professors back in the 1980s, and they came up with a system to measure how well we were doing with our healthcare system. And so they said accessibility is important, right? So here we put quality of care as the central point, but accessibility was the main driver in the research when this kind of these outer terms were selected. So public health is a complex adaptive system that is dependent, or it's determined by 5 major agents. Now, this is my deduction from it. I think that there still needs to be obviously much further research into it, but public health is dependent on availability, accommodation, affordability, accessibility, and acceptability. Now we can define each of these, and we can find that they match at the local level, and they also match at the broader global level or at the community level of the nation. If we look at availability of a doctor, are there enough doctors, right? So is there a doctor available to give you treatment? At the broader availability of public health, is there enough food? Is there enough resources to provide the public with the obvious resources that are needed to keep the public healthy? Accommodation in at the local level, does your doctor's office speak the language that you speak? At the broader level, is the housing, is your neighborhood safe? Is it healthy? Is it conducive to health? Affordability, is there the money for the patients to pay for doctor's visits? At the broader level, are is there enough taxes to pay the physicians, right? Are we bringing in enough in revenue, in tax revenue to provide for our public goods? And accessibility, same kind of thing for each of these, but specifically also for acceptability, meaning that is the quality of care acceptable? And this is obviously at the local and at the broader level, and how we measure that is very important. And it's a question that we must ask and not be dismissive, taking it for granted as a simple question and give a simple answer to.